do that before I forget. All right, my computer says 7. Shall we get going? All right, I'm gonna hit start.
Should I go ahead and start then?
I'll introduce.
Okay.
I will wait until everyone joins, and then thank you all for joining us. We're gonna do introductions in a moment. Well, thank you all for joining us tonight. I know this is a tough time for families to join, and we really appreciate you being here so we can chat about the COVID vaccine for children in Vermont, ages 5 to 11. I'm Dr. Becca Bell. I'm a pediatric ICU doctor at UVM Children's Hospital in Burlington, and I'm currently the president of the Vermont chapter of the American Academy of Pediatrics. And joining us, we have Virginia Clark, who is our ASL interpreter. And I just want to let folks know that closed captioning is available as well tonight. Just so everyone knows, this is set up as a webinar format. You are welcome to post your questions in the Q&A section. Those go directly to us. They are otherwise anonymous, and you can post them as we go. But we're going to have our presenter present about 20 to 30 minutes of overview. And many of your questions will probably be answered during that section. And then we'll spend the second half of the hour doing answering all your questions. So I want to introduce Dr. Kristan Outwater, who is a primary care pediatrician at Brattleboro Primary Care Pediatrics, who's gonna talk to us about the COVID-19 vaccine in kids. So thank you, Dr. Outwater.
You're welcome. You can switch the slide, Stephanie. And so we're all very excited about having the vaccine for the 5 to 11-year-olds. And but we know people have a lot of questions about it. So we are hoping to answer some of those questions tonight. And this is common questions. Does my child need to get vaccinated? What are we protecting the children from? Is it worth it? And what are the risks of vaccination? And we'll try to address that through the slides and then through your answering your questions later on. So the COVID vaccine works like other vaccines. It's basically a set of instructions for your immune system to use to prevent the virus from making you sick. And these instructions, once your body is making the antibodies against COVID, within a few days, the instructions, the vaccine just degrades and the body gets rid of it. So the vaccine doesn't stay around, but the antibodies do, and that's what helps us fight infection or prevents infection. Next slide. And we know from our research that these vaccines are very effective at stopping people from getting COVID. But if you do get COVID from even though you've been vaccinated, that you're more likely to not get serious illness. And the vaccines also seem to reduce the need for hospitalization and reduce the number of deaths in people who do wind up getting COVID-19. We don't know how long the immunity will last. They are studying that as we speak, and we will find out whether we need boosters for children as well as for adults. Next slide, please. We know that the vaccines are safe and effective for adults. They've been studied in children from ages 5 and up. These vaccines appear to be remarkably safe and have been studied intensely for safety, for side effects, for effectiveness. Partly because we're in the middle of pandemic and we have lots of illness around, so the research has gone faster than it usually does, and that's one of the reasons. Next slide, please. This is the timeline. The emergency use authorization for 16 and older was last December, almost a year ago. Then in May, the emergency use authorization was extended to include 12 to 15-year-olds. In August, the vaccine, the initial vaccine received full FDA approval for those 16 and older. And now we have the EUA for the 5 to 11-year-olds. So for adults and for those 16 and older, it's no longer considered emergency use authorization. Now it's considered full FDA approved. Next slide. And with the with the Pfizer vaccine, which is the vaccine that we are giving to children ages 5 to 11 and 12 to 16, over 100 million people have received 2 doses with the Pfizer vaccine, and 12 million children between the ages of 12 and 17 have been fully vaccinated. And we know that the side effects, we know what the side effects are, and again, the risks of getting the vaccine have been low, and we'll talk more about that in a few minutes. Next slide, please. With the children ages 5 to 11, it's a smaller dose. But the immune response is similar to that we see in older people. It's very effective, and we have seen no serious adverse events related to the vaccine in the study population. And the efficacy of 90% was collected during the Delta wave, which makes it very effective against the Delta wave and against the COVID infection that was here before the Delta wave started. Next slide, please. I'm not going to go into detail about this, but this is basically how they determined what dose would be used. They started looking at doses 10, 20, and 30 micrograms. And they found that the 10 microgram dose, the smallest dose, was still remarkably effective. And that's the dose that they settled on. Next slide. And because it is a very small dose, the side effects have been milder than that seen in the 12 to 16-year-old group. So next slide, please. What about side effects? Some people have none. Common side effects are pain and swelling and a little redness at the site. We're not seeing as much of fever, extreme muscle achiness that we see in adults and older children. And but the most common side effects they saw were just headache and some tiredness. And those effects were mild and went away in a few days. Next slide, please. This shows in more graphic detail the information about local reactions. And as you go across for the first dose, the 5 to 12-year-olds, you can see that the redness and swelling was low. And then over at the far right, pain at injection site was higher than placebo, but not as high as with the 30 microgram dose that the older children got. And that was true for the second dose as well. The side effects are milder in the 5 to 11-year-old age group for all the side effects, the local reactions there. Next slide, please. And then the systemic events, these would be fever, the fatigue, headaches, chills, et cetera. And you can see that in the top, the bottom is the placebo, where the children just got saline. At the top, you can see that fatigue and headache were more common. And again, the 10 microgram dose compared to the 30 in each column. And the 30 microgram dose, the side effects were much more. So that the 10 microgram dose that your children will be getting is, the side effects are pretty mild. Next slide, please. And I'm sure you've all heard about the vaccine-associated myocarditis. This came out in this testing for the vaccine for children ages 12 to 16. And they didn't see that. They didn't see myocarditis in the 5 to 11-year-olds that they studied. But we know that when you're studying a group of 20, 30, 40,000 kids, you might miss something that you might see if the study group were 1 million or 2 million children. And so we know that there's an increased risk of myocarditis in the 12 to 17-year-olds after the second dose of this vaccine. It's very rare, just a handful of kids. And as the slide says, 0.01%, so not many. And next slide, please. And we'll go into myocarditis in a little more detail because it is a big concern for parents. We know that COVID-19 can cause myocarditis, and it's can be part of a multi-system inflammatory syndrome. And children are way more likely to get myocarditis from a COVID infection, so getting infected directly rather than from the vaccine. The vaccine-associated myocarditis is mild, and children, for the most part, recovered completely from this. So weighing the risks and benefits, the vaccine is more likely to prevent myocarditis than to cause it. We know that myocarditis from COVID infection is very serious, and the children are hospitalized for longer, and we're concerned that it might be part of a long COVID syndrome. But the vaccine, we haven't seen that with the vaccine. Next slide, please. Late onset side effects. We haven't documented any late vaccine side effects, and we don't expect any because, again, the mRNA that is the vaccine, that's part of the vaccine, just degrades within days. It doesn't stick around. The information, the instructions that it gave the body, that sticks around, but not the vaccine itself. Next slide. Risks of COVID-19 infection in the 5 to 11-year-old age group. Next slide, please. This is important for parents because last year it seemed that the 5 to 11-year-olds weren't getting sick very often. So parents were asking, why should we get them? Why should we get our kids vaccinated if they're not really getting sick? Well, the Delta wave kind of changed that. There have been 8,300 hospitalizations in this age group across the country. And about a third of these children require ICU admission. And those children can be very sick and require days or weeks of hospitalization. And next slide, please. And this shows the COVID-19 deaths by age group. And you can see this in the center is where is the 5 to 11-year-olds. And you can see that the children, the mortality rate is a lot lower than with the newborns and compared to the adolescents. But even though it's a lower death rate, we don't want any deaths. If we can prevent those deaths, that would be nice. And we're also thinking on a public health terms that those under 1-year-olds, we would like to help protect them. And one way of helping to protect them is to immunize their siblings, the school kids. And so seeing if we can prevent some of those under 1 year deaths. Next slide, please. This shows the Vermont cases as of November 6th, and on the chart on the graph on the left, you can see the orange bars down at the bottom. Those are the number of children that have gotten COVID in Vermont. And you can see in the summer, our rates were very low among children. They were out of school, they were out in the open. But as soon as we went back to school and it's getting colder and we're indoors more, the infection rates are just going up. And on the right, you can see the youngest kids are in the low aqua. The purple bars are the age group we're interested in right now. And then the green bars on top are the older kids. So you can see a significant number of 5 to 11-year-olds have been infected during this year. Next slide, please. And this is another graph showing the same thing with the ages, the purple lines, ages 6 to 11 here. You can see that the infection rates are still pretty high and concerning. Next slide, please. This is a state by state level, and you can of number of cases per 100,000 children. And as up to the end of October, and you can see Vermont in the red rectangle there, where our state has done pretty well in terms of number of children infected. Still too high, but better than some states, and I think that's because we've had more vaccinated adults, which helps protect children, and we've done pretty well with masking up. So, but we can do even better if we get children 5 to 11 vaccinated. Next slide, please. And this just shows the number of children ages 12 to 17 who received at least one dose. Vermont is doing very well. That we're over 80%. So, and most of New England has done very well. Next slide, please. So we wanted to talk a little bit more about COVID complications. We mentioned myocarditis. We hear about it myocarditis mostly being from the vaccine, but no, it's mostly due to getting a COVID infection. Though that's where the rates of myocarditis are much, much higher. Also, COVID can cause pneumonia in children, just like it can in adults, which leads to very low levels of oxygen in the body, requiring a child to be in the hospital for oxygen supplementation and sometimes even assisted breathing with a ventilation machine. Next slide, please. In adolescents they've reported many severe COVID cases among adolescents. Again, the vaccine can help protect our young people from getting serious illness, and nationwide, unvaccinated adolescents, just like adults, are 10 times more likely to be hospitalized due to COVID than vaccinated adolescents. So we know it's very protective. The vaccine is very protective. Next slide, please. The multi-system inflammatory syndrome in children. Some of you may have heard of this. This tends to occur after the infection, after COVID infection, sometimes even a week or two later, and is serious enough that children require hospitalization, sometimes support for their organs. The heart may need to be supported, lungs, kidneys, liver, and this is where COVID myocarditis comes in. It's often part of this multi-system inflammatory syndrome in children. So the child can have a recent infection or a current infection. And this tends to be more common in kids who are 5 to 11 years old. And across the US, there have been 48 deaths due to this MIS-C, but a lot more kids in the hospital with it 5,500. And the hospitalization can be fairly prolonged while the organs recover enough for the child to go home. Next slide, please. And again, showing that the 5 to 11 year age group, it tends to be where MIS-C is most common, although it occurs in other age groups as well. Next slide, please. So these are the estimated benefits for every million of the Pfizer vaccine in children aged 5 to 11. And they show it broken out between boys and girls, how many cases are prevented, how many hospitalizations are prevented, cases of MIS-C, 130 in each group, and how many ICU admissions are prevented. And just a reminder that hospitalizations and these complications are worth preventing. These are not experiences our children need or deserve for a preventable disease. And even if the children don't require hospitalization, when they're sick at home and uncomfortable, and you have to take time off from work to care for them, and you're worried about them and how they're doing, these aren't experiences that any of us want for ourselves or our children either. So next slide. So weighing the risks and benefits of the vaccination. Next slide, please. On top here are the benefits. It's a preventable disease. We can prevent COVID hospitalizations and ICU stays and deaths. On the bottom, the risks, and mostly due to myocarditis and pericarditis. Myocarditis is inflammation of the heart muscle. Pericarditis is inflammation of the covering of the heart. And they can occur at the same time. And the vaccine can cause these things, but again, those risks are very low and tend to be much milder than myocarditis and pericarditis caused by the COVID infection itself. Next slide, please. So the factors that weren't considered in that risk balance analysis is the hospital stay is shorter for myocarditis than for a COVID infection. And then the course tends to be milder if it's associated with the vaccine rather than the infection itself. So even with that low risk, that very low risk of myocarditis with the vaccine, it's much riskier to wait to get COVID disease than the vaccine. Next slide, please. Also not considered in that is a transmission of COVID by children and in schools, and the disruption to in-person learning due to illness and exposure. That disruption is happening in a lot of daycare centers. So those of you with children younger than 5 know that well, and we're looking forward to being able to prevent that too. And then post-COVID conditions, we don't have a lot of information in children, but we do know that some children seem to be suffering from a sort of the long haul COVID, and we would like to prevent that as well. Next slide, please. So do the benefits outweigh the risks? In children 5 to 11 years of age, I think that's a resounding yes. Next slide, please. Some other questions parents had: why is the dose based on age and not weight? The vaccine isn't a medication, and so the at different ages, children's immune system responds a little differently, and younger children's immune systems need less prompting to respond. And it's not exact, so that we have to draw the line somewhere. So for some children, they will be getting their first dose of the COVID vaccine at almost 12. Then they will get the 11-year-old's dose. And if they get the second dose after they've turned 12, they will get the 12-year-old's dose. But it's the studies documenting effectiveness were based on, again, the 10 microgram dose. We know it's very effective. And we know the 30 microgram dose is very effective in the older kids. So next slide, please. There are trials underway for children as young as 6 months old. And the doses, I think, are even smaller for that age group. And we hope that that's going to be that vaccine is going to be ready early in the new year, but I don't know for sure. Anyway, next slide, please. Other vaccines, it's safe to give them. If you're in our office, we're going to be giving some kids flu shots at the same time as the COVID vaccine. I don't think that's a possibility in the larger vaccine clinics, but they can be given if you get if your child gets a regular vaccine in the doctor's office and then has an appointment at a state clinic for the COVID shot. Even if it's the next day, that's okay. So they can be given same day, next day, week later, doesn't matter. They'll still all be effective. Next slide, please. Takes around 2 weeks after getting the second dose of the mRNA vaccine for your body to build up an immunity. So again, being cautious for at least 2 weeks. Even after that, they're still recommending mask wearing, and so do we. So, but after about 2 weeks, the child is considered fully vaccinated against COVID. And the COVID vaccines are free, being provided by the state. The Department of Health is offering community vaccination sites. The school clinics have already started. Some of the pharmacies can give the pediatric vaccine. And you can go on the health department website to sign up. We are getting weekly supplements of the vaccine. So the supply is limited by those weekly supplements. We only get what we get. So the state has done a good job of setting up some community vaccination sites around town. And then some local primary care offices like ours will also be offering the vaccine, we hope. And next slide. So registering in advance is a good idea, or scheduling an appointment is a great idea. Next slide. And some resources. And I think that's the last slide. So maybe we can leave that up during the Q&A in case people want to look at any of that.
Thank you so much, Dr. Outwater. And I'm going to give you a few seconds to take a break. And there have been some excellent questions rolling in. So I'm going to read a couple and answer a couple, and then I'll start fielding, hoping you can field some more questions. So one of the questions, this is pretty specific. And a great question. So if a child was going to show signs of myocarditis from having COVID infection, would that be shown during current COVID symptoms or longer down the road? So I think this touches a little bit on some of the unknowns about the long-term effects of the virus itself. And you touched upon that when you mentioned the long haul COVID or post-COVID symptoms that people have. So there's so much we don't know about it. However, I would say that if someone was going to have myocarditis from the COVID infection, that it would likely be apparent if it was going to be significant during their COVID infection. But there is still a lot about the virus and the infection that we don't know. Another question was, so this is a good question, and it's about thinking about infection or disease-acquired immunity versus vaccine-acquired immunity. And one of the participants said, and I wish this was true, with the natural infection, you're one and done. And unfortunately, this we know is not true, because we're seeing lots of people get reinfected with COVID, unfortunately. This is not like, there are some infections that we do get once and build a great immunity to, and unfortunately, this is not one. In fact, we think that really by 90 days post-infection, you're pretty vulnerable to infection. And the other issue is that it's very variable and unreliable. So we can't really predict when someone has COVID infection how great their immune response will have been. There are some people who have really mild infection that really don't build up much of an immunity. And then there are some who are really, really sick in the ICU and they still don't build up an immunity. So the most reliable way to get immunity is through the vaccine. And we know that folks who have had COVID infection who then get vaccinated have great protection in that way, or if they're vaccinated and then they're exposed, and even if they're infected, that they're really protected from serious disease. And the third one I'll say before asking more questions to Dr. Outwater is about, we know that people who are vaccinated can get, if they're exposed to COVID, they're less likely to get infected, but they can. They're less likely to transmit because it's the time of infection is shorter, but they can transmit. So why do we vaccinate? And so I think I always try to remind people, just because something can happen doesn't mean it's the likely thing that will happen. And so vaccinated people are much less likely to get infected. We know in this trial it was 91%, they were 91% protected. Then they're less likely to transmit. And so if someone who's non-infected, they can't transmit. So that is something to remember, that if they're not infected, they can't transmit. And so that really does help with community spread. And so Dr. Outwater, I'm going to ask you this question, and then you can also add to anything I just said. So a participant says, I have an 8-year-old that hates shots. And even though it's being offered at school with his peers, he's adamant he doesn't want to do it. What are your tips?
Well, we have ways in the office, and I don't know the ways of helping the child not feel it as strongly, and I think distraction works very well for some children. I think an 8-year-old doesn't want to be fooled, so not trying to do anything on the sly, but letting them know how important it is, and asking the child, would you like to play a game on my phone while I'm doing this? Because if a child is playing a game on the phone, tying up both brain and fingers to play their thumbs to play the game, they're much less likely to be paying as much attention to the vaccine. We can use some local, like a shot blocker or something like that, to minimize the discomfort for the child. And we also can use some other distractions we haven't to try to get the child to be thinking about other things and experiencing it in a slightly different way. So if the child was not amenable to, I mean, sometimes peer pressure does it, but if that didn't work for your child, then it may be a good idea to have that child vaccinated in a primary care office where they can help with that.
Great, thank you. There are a number of questions here from participants saying that their children recently had COVID. They would like to get them vaccinated. When do you suggest? When can they get vaccinated after having infection?
I think they can get vaccinated any time after the infection. But the child may have some immunity for a couple of months. That's not to say I would recommend waiting that long to get the vaccine. So I think I would go ahead and set up an appointment, but it could be a few weeks from now. You want to make sure your child is feeling good again and healthy after COVID. And there's some evidence to show that the vaccine, when given to somebody who has recovered from COVID, that they get a much bigger boost to their immunity than just the infection alone provided. If you can think about it in the sense that when you give somebody the vaccine, and that set of instructions that I talked about, that your body then makes some antibodies against, your body's doing that when you're healthy. When you get COVID and you're ill, then your body's trying to make those antibodies when you're sick. And it's that's a challenge. The immune system is not overwhelmed by vaccines. It can get overwhelmed by infection. So the vaccine, even in a child who's had COVID within the past few weeks, still is they're going to get a nicer boost to their immunity than they would already have from the infection.
Great, yes. And we do want to remind people that just to underscore, to wait until you're out of your isolation period if you have COVID, not to go to a place while
Thank you.
you're potentially infectious. That's all. So 10 days afterwards. Yep. So there's a question about what about giving Tylenol or ibuprofen to a child after their shot if they have, a headache or any, muscle aches or anything like that? What do you think about that?
I think it's fine to do. I think I would not give it to them in advance to try to prevent those things. But I would wait and see what side effects they do have before I would give them anything. But I think it's safe to do that, just like we do for regular vaccines. I know there was concern initially in the beginning of the pandemic about using Tylenol or ibuprofen during COVID infection or for the vaccine in terms of immunity. But I don't think that's played a big role. So I think it's safe to do and to help your child be more comfortable. But I would give it just as needed, each dose, and wait to see whether they actually still have side effects rather than just giving it around the clock.
Great, thank you. There is a question here about, and this may have come in before you talked a bit about why vaccines are based on age and not on size, but just to be sure, because a lot of people have this question, it's a good question. Someone says that their daughter is 5 years old and very petite. So is it safe for them to receive the vaccine?
Yes, it's still very safe. And even with the small, even with a small child, it's a tiny amount. It's the amount that we will be injecting is smaller than some of the vaccines we're using now for smaller kids. So I think in terms of the amount, the volume of the vaccine, and in terms of the dose, it's fine. Again, we're using the age cutoffs. So we know that the dose of 30 micrograms is safe for 12-year-olds. And yet 11-year-olds are going to get 10 mics. So, and we know that both are safe and effective. So I think at the other end of the spectrum, the same thing's going to be true. So we would not want to adjust the dose down to accommodate smaller size. I think we would be risking having a less than good response to the vaccine.
There's a question here, and I can answer some of this because I know some of this data, and you can add to how many healthy kids with no pre-existing comorbidities who contracted the virus end up in the ICU or dying. So I know that nationally, the data for ICU admissions is that a third of children admitted to the ICU have absolutely nothing on their record, no medical conditions. I would add though that I think people may be surprised by what might be considered a health condition or a comorbidity. And sometimes that might be just obesity or a history of asthma. Those things are very, very common. And so the thought that I think thinking about your own child and thinking about their risk, my children don't have any medical history at all. And, they're both going to get vaccinated. One got vaccinated today, actually, which is very exciting. That there's still definitely a risk. I would say in Vermont, we have hospitalized, completely healthy children who were very ill from the virus, who had absolutely no history. And so one of the problems we're having is we're having a hard time understanding who exactly is at risk. And that was one of the discussions around with the advisory boards, was when they were talking about recommending this vaccine, or is there a subpopulation of this group that we really should be recommending? Is there a certain condition that makes people really at risk and we should recommend to that group? And the answer was no, because there are enough healthy kids that were getting really sick that really the risk benefit analysis is that everyone really would benefit. I don't know if you have anything to add to that, Dr. Outwater.
No, I think that's, we know that this vaccine is very good at preventing hospitalizations and deaths. And so what kind of a risk are we willing to tolerate for our own children? I mean, I wouldn't want to tolerate any risk there for something that we could prevent, when the risks of the vaccine are so low compared to the risk of the disease.
I have a series of questions. I'm gonna summarize it kind of into one question, and I can give my thoughts and you can give your thoughts, because I think I'm so glad people are asking about this because it's super common. So some thoughts about does this vaccine affect, is it considered gene therapy? Likewise, can it affect fertility down the line, or is there any other kind of late onset thing that can show up based on this vaccine? And I'm glad people are asking that, because they're very common questions. And, with the messenger RNA in particular, RNA sounds like DNA. And so, there's a lot of confusion out there about that. So when you think about a cell, I was previously a high school biology teacher, so I can remember drawing these on the whiteboard. So you have a cell, and then you have the nucleus, and the DNA is in the nucleus. So the messenger RNA comes into the cell, but not in the nucleus. And you have a ton of mRNA in every cell, tons and tons, like that, hundreds of thousands of pieces of mRNA in your cell. So this is another mRNA that then tells your body how to make this protein that looks a bit like the virus. So it does not affect your DNA. So it can't change your genes. It can't change anything about anything that you would pass down in terms of fertility. It doesn't even go into that part of the cell. But that is a common question. And so along those lines, what about something sort of that just would show up later? And again, the biology around it, there's no real mechanism for that to happen. And with the mRNA in particular, the big challenge of using mRNA is that it disintegrates very quickly. And so that was a big part of developing mRNA technology, was that it kept disintegrating so rapidly that before it could even really have an effect. And so scientists were trying to figure out how to like wrap it in that fat bubble so it just stays in your body a little bit longer. We all know about the challenges around keeping it super, super cold. So this is something that degrades very quickly. So it doesn't hide in your body anywhere to cause problems later on. And in fact, we don't have any vaccines that have ever shown up with, caused a problem that showed up later in life. Everything we see happens really in that first 6 weeks. Even very, very rare things, it all happens in that first 6 weeks. I don't know how else you talk about this, Dr. Outwater, because I think these are really common questions.
Yeah, no, I think that's all correct. And I think in general, vaccines, as you say, they don't stick around. Vaccines have been used for decades, centuries, really. But the modern vaccines have been used for decades and decades, and none of the other ones have any any side effects that show up, a long time later. There's been no associated fertility issues with these vaccines. So again, they seem very safe. And the mRNA is, it is just a set of instructions that degrades fast, and then you just get rid of it. The instructions, the cell took the instructions and made the proteins it needed to make, the antibodies. But the original instructions are not there anymore. So.
And I will just take a moment really though to say, like, these are such challenge, when you hear stuff like this, it's such a challenge then to make a decision about vaccination. And I think those of us in pediatrics have been answering a lot of those types of questions well before the COVID vaccine, because really with every vaccine, there's some, really, concern, and then lots of misinformation about some long-term effects. And one of them is always about fertility or development. There's always that. So it's not new. Some of this stuff isn't new. So we're used to talking about this and understanding that it's scary when you hear about that. And so what we always think about is just understanding the context of what we know biologically, and what we know could plausibly happen. And I think just thinking about, and I bet Dr. Outwater is the same. I prescribe a course of antibiotics pretty frequently, right? And parents will say, what are the side effects? And, you might say they could have a rash, or they could have some GI upset with this short course of antibiotics. I've never had a family say, but in 5 years, could this affect their fertility? Ever. No one's ever asked me that. But it's also not possible. But similarly, vaccines, there's no biologic mechanism for which they would affect your fertility or something long-term. So I think this is something we're used to hearing. And we also just really empathize with families who are hearing some of this information and how, really like scary it can be. And I don't know, there's a few more questions that I'll scroll through, but I don't know, Dr. Outwater, if you just kind of have like general thoughts about when you just talk about any type of vaccine with families, like how you help them make this decision.
Yeah, I think, my perspective, obviously I've been practicing pediatrics for decades now, and a lot of the diseases that we vaccinate children against, I saw in my training and early years of practice, because they were active diseases then. And the vaccines, they're always created when a need arises and when the technology is there to create the vaccines, but they're all created to prevent death and disability. And they've all been, the ones that we use today have all survived the test of time. And the COVID vaccine seems like it was developed super quick, but this is a vaccine that's been developed in the middle of a pandemic. So lots of patients that it can be tested on. And so we've got lots of data we also have the technology to monitor safety and side effects in a much bigger way than we ever had. They've always been careful about monitoring for side effects, but now it's being done on a global level. So we have millions of people who have gotten the vaccine, and millions of people who they've studied side effects closely. So we have lots of data on the safety of the vaccines, which to me is very reassuring. That when we say this is a very safe and effective vaccine, both of those things, safety and effectiveness, have been very well studied, again, because there's been so many people who have been sick. So
I have a great question here. There's an 8-year-old listening and wants to know if this will hurt. And I think this is an opportunity to, one, we always want to be honest with kids, but we also, we've all gotten the vaccine, or many of us have gotten the vaccine, right? So talking about your own experience, and in fact, not to put anyone on the spot, did it hurt today when you got vaccinated? It did a little, right? Yeah. So my 6-year-old just got vaccinated today, and it hurts. He said, it felt like a sting. But he actually said, but with a bee sting, nothing good comes of that. At least with the shot, you're getting some immunity. So yeah, I think it's no different than any other shot, really. But I think we always want to just be honest and prepare kids that it does feel like a sting, and then it's sort of over quickly, and we can talk about how lots of us are getting vaccinated. I know lots of kids are just coming into school and saying, I got vaccinated this morning, or I got vaccinated yesterday, and talking about it. And it's this great sort of communal feeling to do it. And I don't know what suggestions you would have for an 8-year-old, Dr. Outwater, about getting
I think if you're being vaccinated in school, maybe talk with one of your friends, tell them a story while you're getting the vaccine so that your mind is thinking about the story, do something to distract yourself. If you're getting it in a place where you can play a video game on your mom's phone, that's distracting for your brain, and your brain doesn't have as much time to pay attention to getting the shot. And the shot is over in seconds, even before you count to 5. The shot is done. And so that is, so it's very fast. So you just need a quick distraction. And so I think distracting your brain works pretty well. If you're in a doctor's office, they might have a few other techniques. They're not going to put you to sleep, and they're not going to be able to give you anything by mouth to make it better. But again, it's so quick that you won't need anything like that. So I would recommend doing something like that.
Folks are asking about if this will be, it is being recorded and it will be posted on our website. All of these are, so the one that we did on Monday is posted there as well. What about?
I did have one more suggestion, and for the 8-year-old, and that is remembering this is a quick and very short thing. It is like a sting, but even if you are, even though you know that there are bees outside, sometimes you still go outside and play, and your fear of bee stings doesn't keep you from playing. If you get stung by a bee, it's going to hurt for a second and then be done with. So trying not to make your brain take over and say, this is the hugest shot ever. It's not. So you want to keep it in mind that it's a little thing. And most 8-year-olds are pretty brave. They'll go out and ride their bikes and play hard. And if they fall and skin their knee, it's like they get up and run. It's like, okay, I'm not letting that get in my way. And I would look at this vaccine the same way. It's quick and done. Oh, and there's the brave boy who got his shot this morning.
Yeah.
Good for you.
I know you had sort of mentioned in the presentation that we don't know exactly, we can't predict the timeline on boosters and all that, but folks are asking a bit more about what some expectations might be. Is this an annual thing? Is this we get 3 doses and then we're kind of good? Do you have any insight into that?
I don't, my suspicion is that, that it may turn out to be like the flu vaccine once a year, and or once every couple of years, in order to keep the amount of COVID under control. This is something, the vaccine is something we do for ourselves to protect ourselves, but it's also something we do for our neighbors, our grandparents, our friends, because it helps protect them if we're vaccinated. So it's both a personal protection and it's community protection. It's a good public health measure. And I think as time goes on in the next year or two, we will know whether this will be a yearly vaccine or not. So we don't know what the effect of the boosters that older people just got. They'll be studying, what happens over time to immunity and then making recommendations, but it may be like the yearly flu vaccines. My guess is it won't be any more common than that.
And I'd love to lean on your expertise in childhood vaccinations and sort of thinking about applying that to this. So I'm actually trying to rack my brain, but every childhood vaccine requires a couple doses, right? We don't have any vaccines that you just get once. It's very normal. Like if you think the 2, 4, 6-month vaccines are the same vaccines that we're getting, right? And then there are some vaccines that if you get it later in life, you have to have more doses than if you have it earlier in life. Can you talk a little bit about that?
Yeah, I think when children get vaccinated when they're younger, they tend to have a very robust response to that. So that lasts a good long while. But we know as people age, they can get their immunity to some of the childhood vaccines can wane a little bit. But we don't, even so, we're not necessarily recommending boosters for those. And I'm trying to, for instance, the tetanus booster, we know that they're recommending that every 10 years to protect us all from tetanus, which is in the dirt. It's in, rusty nails. It's in, so it's just one of those things that's around in the environment. So some vaccines are like that. Others, like the chickenpox vaccine and the measles, mumps, and rubella, you got 2 doses when you're younger. But again, the second doses of those were recommended later. The vaccines had come out and were being used, and they discovered that the immunity was waning, and so they recommended booster shots for both of those. So I don't know where the COVID vaccine will fall in terms of those. The mRNA technology is new. I think they're going to be applying that to other vaccines. I think they were already applying it to other vaccines that were pretty close to coming on the market when COVID pandemic hit. And so some of those projects were sidelined in order to focus on the COVID vaccine. So I think we're going to find the mRNA technology for vaccines to become more common and useful for other diseases we would really like to prevent that cause illness in children. So.
And I think this will be the last question. And this question kind of touches on the varying benefits of vaccination, and one being the public health benefit, which you've sort of touched on. And this person is thinking about, children getting vaccinated could protect those who are unvaccinated. So that will be the young kids and other people who aren't vaccinated. but even it will also protect adults who are vaccinated, but say either their immunity waned or they have an, I'll add, they have an immunocompromised state, which they weren't really able to mount a response to the vaccine. So just sort of touching a bit on the secondary, we talked a bunch about the direct benefits to the child. And for us as pediatricians, that's the most important thing, right? Does this benefit the child? Does the benefit outweigh the risk? We're not asking children to get vaccinated to protect other people. Like, this is for them. But talking a little bit about some of the secondary benefits, like as public health, as a public health picture.
Yeah, and so there are people who are immunocompromised that don't mount a great response. So having the community vaccinated helps protect those people. Those might be older people with a variety of illnesses that suppress the immune system, but they also might be children in your kid's school. They might be your child who's undergoing chemotherapy for leukemia or other cancers. Those children aren't going to have an effective or may not have an effective immune response, or it may not be quite as robust as needed. And the effects of getting COVID infection in those children could be devastating. And so those children are not going to be able to socialize with other kids unless those other children are protected from COVID and protected from other vaccines. And that's one of the reasons why schools have some vaccine requirements. It's so that all children can attend school, and the children who are immunocompromised aren't being told to stay home because it's too dangerous for them to go to school. They should be afforded the same rights as other children to attend public schools or to attend school in general. So the immunocompromised among us can be any age group and are certainly in the our newborns that are home with older siblings. They're also at risk for disease and death from COVID. So we want them protected by making sure that their siblings are vaccinated. And we know we do this for parents and grandparents who are strongly encouraged to get the tetanus pertussis vaccination before visiting their newborn in the hospital, and flu vaccinated before visiting their newborns in the hospital. So we already have these strong recommendations, or for some young parents, they're going to mandate it for their parents and grandparents. Don't come and see my kid unless you've had the flu vaccine and the Tdap, because I don't want you giving my baby pertussis or influenza. So that there's already that social pressure really for the vaccinations. But I think that's good social pressure. It's again, we do this for our community as well as for ourselves.
Well, I think that's a great note to end on. We had great participation, really amazing questions from participants. Dr. Kristan Outwater is a primary care pediatrician at Brattleboro Primary Care Pediatrics. We are so happy to have you here. And you can find this recording in the next couple of days on our website at aapvt.org. And we really encourage folks otherwise to reach out to your child's medical provider. And the health department on their website has information for, more reading and vaccine clinics. And thanks again. I know it's a tough time of night to join us, but we really appreciate it. So thank you.
And yes, thank you for all your questions.